This is my video update number 2. I am currently placed at JMU softball. What I have liked best about this clinical rotation is really learning all about the different biomechanical aspects that are involved within softball and how these can lead to injury. In class, we really only focus on baseball and its biomechanics and how it leads to different injuries, especially like the UCL injury. But softball is not really touched on, and so it's been really cool to learn about the sport, especially in pitching. And the different biomechanics behind the pitching of the softball pitcher, and how that can lead to injury, and different things like that. So it's been super cool about this clinical rotation to kind of look into that and learn about it, as well as work with the strength and conditioning coach and ask him about it and learn things from him. Has been really awesome about this clinical rotation that I didn't get at my last one. What can I do to make the clinical experience better? Right now, I feel like I'm doing almost my best in making this clinical experience the best for me. I, again, still need to continue just to jump out of my comfort zone and make sure that I am going in there, doing the evaluations that I can, doing any other things that I can do within the athletic training room, and just trying my best to get as much experience out of it as I can, and just trying to get out of my comfort zone and not being afraid to jump in there and just do it. And if I fail, that's okay, and to not get too hard on myself and just to learn from it. I do think that will be the most beneficial in me making my clinical experience better. What has been the biggest challenge this month is definitely, having the amount of hours that softball has. I've done pretty good with my time management, and I've also talked to my preceptor about it. It's really just, the softball games are extremely long, and, my preceptor needs all the help that she can get, and I just absolutely love being at the softball games and learning, but, it's still a challenge to make sure that I get the sleep that I need and making sure that I eat when I need to and getting that self-care in as well. So kind of this past month has been a little bit challenging in trying to, make sure I'm getting all of that self-care in, along with getting the experience that I want to get at softball, because, I love being there as much as I love doing self-care for myself too. So that's kind of been the biggest challenge this month. What progress have I made in completing my checkoffs? I've made some progress. Haven't got all of them yet, which there's quite a few of them, so I knew I wouldn't have them all done by this time. Me and my clinical preceptor are going to try our best to maybe get one at least once a week, or 2 a week if we can, to make sure that I get them done on time. But so far I've made pretty good progress on them, and I'm going to continue my best to make sure that they get done on time.